Hi, this is Dr. Rachael Coleman with Being Health. Being Health is a 501c3 nonprofit organization created to provide health information with the goal of improving health literacy of the community at large. We're not here to provide any medical diagnosis, but we encourage you to have your own healthcare provider and get the health care that you need. Hopefully, you enjoy today's health topic. Stay tuned. Anybody ever heard of diabetes? Okay, all right. So I want you to pay attention, track with me a little bit, okay? Um, well, what is it? It's a long-lasting, or what we call chronic health condition affecting how the body turns food into energy. So after eating, the body breaks down most of the food into sugar, or what we call glucose. Rising levels of glucose in the bloodstream signals the pancreas to produce insulin. Insulin lets the glucose into the body's cells so that it can use that glucose for energy. Insulin acts like a key. Without it, glucose can't get into the cells. Or it stops responding to the insulin. Too much glucose remaining in the bloodstream can cause health problems over time like heart disease, blindness, and kidney disease. There are many types of diabetes: type 1, type 2, gestational, and what we call prediabetes or insulin resistance. Type 1 is thought to be caused by an autoimmune reaction where the body mistakenly attacks itself. The body stops making insulin to those affected, and they have a patient, and those affected, they have to take insulin. This can be diagnosed at any age. We used to call it juvenile onset diabetes, but actually it can be diagnosed at any age, and half of the people are actually adults when they're diagnosed with type 1 diabetes. 5 to 10% of people who have diabetes have type 1. It's really unknown at this point how to prevent type 1 diabetes. Type 2 affects 90 to 95% of people who have diabetes. The body doesn't use the insulin well, and the body can't keep blood sugar levels normal. It develops over years, and some people may not even notice symptoms. It's usually diagnosed in adults, but guess what? The kids and teens, because of our lifestyle choices, are developing what we used to call adult onset type 2 diabetes. But it can also be delayed or prevented with lifestyle changes like losing weight, being active, and eating healthy food. What's gestational diabetes? This is when pregnant women who have never had diabetes develop diabetes. It usually goes away after the baby is born. But having gestational diabetes increases the risk for type 2 diabetes later in life. And the baby's also at higher risk for health problems and obesity in childhood or as a teenager. And also that child is at risk for developing type 2 diabetes also. Prediabetes. This is when the blood sugar or glucose levels are elevated, but they're not high enough to be to make the diagnosis of type 2 diabetes. It affects 1 in 3 in the United States. 1 in 3 have prediabetes. This raises the risk for developing diabetes, heart disease, and stroke. But guess what? Good news. Lifestyle changes can reverse it. What are some of the common symptoms of diabetes. It can be frequent urination, thirst, excessive thirst, feeling very hungry even though you're eating, extreme fatigue, blurry vision. Cuts and bruises can be slow to heal. And type 1 diabetics tend to have weight loss even though they're eating. And type 2 diabetics tend to have neuropathic symptoms like a tingling pain or numbness in the hands or feet. Unfortunately, diabetes can come with complications, and we want to avoid some of these complications with some behavioral and lifestyle changes. What are some of the complications that can happen there? Diabetes can affect the organ systems, from cardiovascular, can cause complications of cardiovascular disease, chronic kidney disease, neuropathies. There could be foot complications, skin complications, oral complications, hearing loss, stroke, and there's also something that's called diabetic ketoacidosis. Well, with the cardiovascular complication, it's the #1 cause of death in people with diabetes. The heart blood vessels are negatively impacted. People with diabetes are twice as likely to have heart disease or stroke. But the risk can be reduced. Guess what? Diet, exercise, and diabetes management. Chronic kidney disease. Diabetes is the leading cause of chronic kidney disease. Blood pressure, genetics, and blood sugar management can modify this risk. Anybody hear of neuropathy? There's different types of neuropathy. We generally think of peripheral neuropathy, but there's also autonomic neuropathy and other neuropathies like Charcot joint, cranial neuropathy, compression mononeuropathy, femoral, focal, thoracic, unilateral foot drop. But we'll just kind of focus on the peripheral and autonomic for now. In peripheral neuropathy, this is the most common type of neuropathy. It can affect the nerves of the hands, the feet, legs, and arms. It generally starts in both feet at once. There can be a tingling or pins and needles feeling. Some people feel burning or stabbing or shooting pains. Some people feel like they're wearing a sock or glove even though they're not wearing them. The feet and hands can get either very cold or very hot, or they can be numb or not feel pain at all. We can diagnose peripheral neuropathy with a monofilament or a tuning fork. This is why it's important to see a doctor, right? And have that diabetic foot exam, especially if you've been managing your diabetes or been diagnosed. Other tools like a nerve conduction study or electromyography, what we call an EMG, can also be used. It's treated by getting glucose levels to goal. There's no treatments to reverse it once there's established nerve disease. But we manage the pain with different medications. And we want to keep the feet and the legs very healthy. Autonomic neuropathy. This affects the nerves in your body that control your body systems. It affects the autonomic nerves that control the bladder, intestines, genitals, and other organs. But you didn't think it affected the genitals, right? It can be bladder paralysis. Nerves no longer respond to pressure as the bladder fills. There can be bladder control problems. Frequent bladder infections can develop. It can affect the small intestine, where it can be manifested by diarrhea, especially at night. Or it can be constipation. The stomach can also lose its ability to move food through. It can cause vomiting and bloating, what we call gastroparesis. Symptoms may include heartburn, vomiting of undigested food, feeling full after eating only a small amount. So in the men it can cause erectile dysfunction, and in the women it can cause problems with orgasms and vaginal dryness. There can be loss or low blood sugar symptoms, or a person can sweat a lot at night or while eating, or no longer sweat at all. There can be heart manifestations. If a person stands too quickly, they may feel dizzy. And sometimes persons with diabetes with autonomic neuropathy can have a heart attack without even feeling chest pain. Diagnosis and treatment depends on which area is affected. And so this is why it's very important to talk with your healthcare provider. And I know a lot of times there's not a lot of time in office visits, so I do encourage you to write things down. And don't just share it with the provider once they get in the room, but let the medical assistant or the nurse working with that provider know ahead of time that you want to talk to the provider about these symptoms that if you're experiencing them. All right, so in summary, diabetes is a chronic condition affecting glucose metabolism. Most individuals are type 2 diabetic. It represents 90 to 95% of those diagnosed with diabetes. There's not always symptoms, but there may be increased thirst or urination or some of those other symptoms we discussed. There are complications that can affect every organ system of the body. But the good news is lifestyle modifications like weight loss, exercise, and healthy eating can improve disease burden and outcomes. Presenting intellectual health is certified nurse practitioner Ramona Wright. She's board certified by the American Association of Nurse Practitioners and she has an extensive history in healthcare. She's worked in local hospitals, providing inpatient acute care to infants, neonates, and inpatient hospital care and adolescent psychiatry. She's worked in local public health and school health. She currently provides health and medical care at a federally qualified health center. She's a member of the American Psychiatric Nurses Association, and she holds certificates in management and treatment of substance use disorders and HIV prevention. She has interest in immigration, refugee, and travel health to provide health assessments needed for compliance with U.S. immigration laws and destination country requirements. Ramona Wright is married and has 3 adult children, a wonderful son-in-law and a beautiful daughter-in-law. She loves gardening for aesthetic purposes, as well as cultivating medicinal herbs and seeking out herbal remedies used by various cultures around the world. Please welcome certified nurse practitioner Ramona Wright.
Thank you very much for that warm welcome. And thank you, all of you wonderful, phenomenal women. Give yourselves a clap. A great group today. And I won't be before you long. I'm not going to wear your patience. If you will bear with me for a few minutes, we're going to talk about intellectual wellness. My tech people here are getting something together for me. But while they're working on that, I just want to say that intellectual wellness has to do with one's ability to reason. It's one's capacity for using logical thinking and versus the mind, which is more of an emotional. We're talking about decision making, one's ability to make sound decisions. And you can either be dominated by emotions, or you can be dominated by intellect. So as we look at the slides here, so the 8 dimensions of wellness, as Dr. Coleman mentioned, they're all overlapping. So we can have intellectual wellness, but it doesn't exist independent of your blocking me there. It doesn't exist in the goodbye, good luck. Okay. It doesn't exist independently of the other domains of wellness. So they're all interrelated, interconnected. We see here a focus on the brain, the seat of intellect. That light, are all your lights on? So when you speak to people, when you hear people, when you listen to people, you have to ask, I wonder if all the lights are on up there. So that's another representation that I have for you of the brain. And to my left and your right, you'll see like the neurons in the brain, the neural capacity of the brain, the interconnectedness and the interrelatedness of the brain. It's probably one of the most powerful organs in your body, but it doesn't function independently in and of itself. All of your faculties are interrelated. But I would dare say to you that intellectual wellness begins way before you become the person that you are today. Moving on. There we go. Your intellectual wellness starts before you're born. Your genetic code, who you are, and the person that you're going to be is limited or enhanced by your interuterine environment. So we need to give more care and concern for our pregnant women. So a lot of talk and politics and a lot of things going on regarding our pregnant women. But I would say we need to really be careful and support them and make sure that you are enabling them to have the care that they need, because there's a brain developing in there. Intellect, intellectual capacity. So, what is my intellectual capacity? As I mentioned, it begins with conception. Before you were formed in your mother's womb, it was already happening. So early prenatal care, self-care, OB-GYN, midwife, doula support, essential, absolutely necessary. So here we see my son-in-law supporting my daughter. Shopping, all excited about the baby, too tired to walk out of the store. I think we was at Home Depot or something. And there she is, pulling her on the cart. There she is sitting there. I think that church says she's eating for 2 and I'm drinking for 3. But he did well. He made it through the 9 months. And, so we just want to support that growing baby in there, support that brain health, support the intellectual development. As I mentioned, intellectual thinking, reasoning, guided by the intellect rather than by emotion. Or if you use it as a noun, it's a person who possesses these qualities. So I can look at Dr. Felice and say, boy, she's an intellectual because she's highly intelligent, she's very articulate, and she's done the work. Everyone that says they are an intellectual, follow the reasoning, follow the train of thought, follow the cognition. So, trying to wrap, I'm going to wrap this up. But, yes. Are all people created equal? You hear this a lot. Is that true? Do you think it's true? Are all creatures equally endowed? It depends on your paradigm. It depends on your thought processes and how you think. But I'm going to make it simple. All people are not equal. It's impossible. If you came out of your mother's womb and you were already at a deficit for whatever reason, you don't have a fully functioning brain. That does not make you any less of a person. You are an equal person. You have an enormous capacity for intellectual wellness, but all people are gifted equally. But it doesn't mean we're any less. So you can't look at somebody because they haven't achieved what you've achieved and think, well, I'm better. You're not. And the fact that you can even think that way should let yourself know you're not. So, are all creatures endowed equally? No. I have two nephews that are severely and profoundly developmentally delayed. Twins, affected from birth. They're not going to get to graduate from high school and wear a cap and gown and go to the famous halls. We're not going to be celebrating them earning a bachelor's degree. It's not within their intellectual capacity to do that. But they're not any less of a person. They just don't have the same endowed abilities that many of you may have. So where does that leave us? Why do you have intellect? Why did God give you intellect? Why were you not one of those people who were born developmentally challenged? Why not? It's a gift from God. So you're gifted. And there's a reason for that. You are here for the community. You're not intellectually, your intellectual wellness is not just for you, it's for the community. It's so that somebody else can achieve the heights of their intellectual wellness because you shared, because you gave, because you knew that whatever level of achievement that you have achieved, it wasn't so your nose could be up. It was because it's a gift that was given to you to give to others. Did you know? The more you give, the more you receive. Did you know that the late, great Jesse Dixon wrote a song and said, every time I get lifted up, when we lift each other up, when God gets lifted up, we all get lifted up. It raises a standard. The enemy can come in like a flood, but guess what? Raise a standard. Community does that. When we share, when we develop our own intellectual wellness. So, these are some quotes. So, intellectual wellness recognizes creative abilities. We all are gifted. It might look different on you than me. He said, you only live once. But if you do it right, once is enough. Then Mahatma Gandhi, live as if you were to die tomorrow. That means don't waste your time. Be busy. Learn as if you were to live forever. So, be yourself, because everybody else is taken. So ways that you can develop, learn a new language. Review history. These are things that stimulate your intellect, stimulate your wellness, so that you can give back to others. Review history. Did we learn anything from it, or are we still learning? Learn about a political view that's different from your own. Did you know we can have conversations without being dogmatic? We can. We can do that. It expands your intellectual capacity, strengthens your intellectual wellness. Now, for us from the Christian paradigm, how are you going to share something with somebody you don't even know what they believe? You don't have a clue, but you're going to have a conversation. So intellectual wellness says, I don't know about this. Let me find out. Let me do some digging. And it strengthens your wellness. Learn a language. Do you know how many people don't speak English? So write down your thoughts. Keep a journal. Journal of activities and record stories about your life, which we've heard today. And I always say this is one quote that has stuck with me because her publishing company published this book. Education is a tool that can take you places you may not otherwise go. But the lack of it does not fully determine your destiny. Amen. You might not be destined to spend 8, 10 years of college like Dr. Coleman. Your destiny might be you spend 6 months somewhere learning how to be a coach. But if that's your destiny, if that's what you're called to do, if that's the capacity of your mental faculties, and there is no limit to how much you can learn. Did you know that? Yeah. Nobody put a cap. Now, we're talking about healthy adults with a fully functioning brain. There's nobody that said, oh, that's enough. You don't need to learn no more. Now, there was a time when that was true, wasn't it? But, thanks be to the Lord, somebody kicked down some doors. And now, you can learn, you can stimulate your intellect as much as you want, as much as you're willing to take the time to do. Like was said on the other, these things all overlap. So, get out, enjoy nature. That stimulates your intellect. If all you do is sit down and read books all day long and stay in a room and look at a desk, I had a picture of my daughter up there. She was sleep studying. She told me to take it down because she looked a mess. But the sky's the limit, people. And regardless of whether you have a high school diploma, maybe you didn't even finish high school, stimulate your intellect. Shoot for the stars. Shoot for the sun. Shoot for something.
Well, that's all for now. Hopefully you've gained some important insights and learned something new. Make sure you follow us on Facebook at Be in Health Inc. or Be in Health INC. Until next time, be well, stay physically fit, and be in health.